Hey there, welcome to my channel. Are you curious about cognitive behavioral therapy, or CBT? You're in the right place. In this video, we'll explore what CBT is and its basic principles and how it can help with various mental health conditions. So let's dive in. So, what is cognitive behavioral therapy, or CBT? CBT is a type of talk therapy that focuses on identifying and challenging negative thought patterns and behaviors that contribute to mental health issues. It's a problem-focused approach that aims to help individuals understand how their thoughts, feelings, and actions are interconnected. Now let's explore the basic principles of CBT. These include principle number 1, cognitive distortions. CBT identifies and challenges negative thought patterns known as cognitive distortions. Principle number 2, thoughts, feelings, and actions are interconnected. CBT recognizes that thoughts, feelings, and actions are intertwined and that changing one aspect can impact the others. Principle 3, learning and experience shape behavior. CBT acknowledges that behavior is shaped by learning and experience, and that new skills and coping strategies can be learned. Principle 4, present focused. CBT primarily focuses on the present moment, rather than dwelling on the past or worrying about the future. Principle 5, collaborative. CBT is a collaborative process between the therapist and individual working together to identify and challenge negative thought patterns and behaviors. How CBT works. First, identify negative thought patterns. The individual and therapist work together to identify negative thought patterns and cognitive distortions. Next, become aware of emotions and physical sensations. The individual learns to recognize and understand their emotions and physical sensations. 3, challenge those negative thoughts. The individual and therapist work together to challenge and reframe negative thought patterns. 4, learn new skills and coping strategies. The individual learns new skills and coping strategies to manage their mental health and achieve their goals. 5, practice and reinforcement. The individual practices new skills and coping strategies with reinforcement and support from the therapist. Now, let's look at an example of CBT in action. Imagine someone who experiences anxiety when public speaking. A CBT therapist might help this person identify and challenge negative thoughts, such as, I'm going to fail, or I'm not good enough. The therapist might also teach relaxation techniques, such as deep breathing or progressive muscle relaxation, to help manage anxiety in the moment. Here are some examples of reframing negative thoughts. Negative thought, I'm a total failure for making that mistake. Reframe thought, I made a mistake, but I can learn from it and do better next time. Negative thought, I'll never be able to do this. It's too hard. Reframed, this is a challenging task, but I'll break it down into smaller steps and take it one step at a time. Negative thought, I'm so anxious. I just know something terrible is going to happen. Reframed, I'm feeling anxious right now, but that doesn't mean something terrible is going to happen. I'll focus on the present moment and take things one step at a time. Negative thought, I'm not good enough. I'll never be successful. Reframed, I have strengths and weaknesses just like everyone else. I'll focus on building my strengths and learning from my weaknesses. Negative thought, I've had a bad day. My whole week is ruined. Reframed, I've had a tough day, but that doesn't define my whole week. I'll focus on the present moment and take things one step at a time. Here are some reframing techniques. Challenge absolutes. Replace absolute language such as always, never, or total with more balanced language. Focus on the present. Instead of worrying about the future or past, focus on the present moment. Practice self-compassion. Treat yourself with kindness and understanding, just as you would a close friend. Reframe negative self-talk. Challenge negative self-talk by finding evidence to the contrary, or reframing negative thoughts in a more balanced way. Use positive affirmations. Replace negative thoughts with positive affirmations that promote self-confidence and self-esteem. CBT is a versatile therapy that can be helpful for a range of mental health conditions, including depression, anxiety disorders, PTSD or post-traumatic stress disorder, obsessive compulsive disorder or OCD, and eating disorders. Thanks for watching. CBT is a powerful tool for managing health conditions and improving overall well-being. If you're interested in learning more about CBT or finding a therapist, check out the links in our description box below. And don't forget to like and subscribe to this channel for more videos.